everyone, and welcome to Functional Fertility, the podcast designed to demystify your hormones, up-level your lifestyle, and supercharge your fertility potential. I'm your host, Dr. Kalea Wattles, and today's episode is all about supporting our mental health, featuring my guest, Everest Goldstein. Everest is the founder and CEO of Everest Functional Psychiatry and Wellness. She's a psychiatric nurse practitioner and certified functional medicine practitioner. In her functional psychiatry practice, she takes a holistic approach to healing the body and mind and integrates lifestyle, diet, medicine, and other innovative technologies into her practice. We're so fortunate to have her with us today talking about how we can care for our mental health as we prepare for pregnancy and postpartum life. Welcome to the show, Everest.
Thank you, Kalea. I am so excited to be here and talk all things fertility and mental health. So as we know, it goes hand in hand. Just can't wait to dive in.
Certainly does go hand in hand. And I just have to say, before we get started, you and I had an opportunity to meet in real life earlier this year. We met up in New York City, and it was so fun to get to know you. And I love seeing other women in healthcare living in their purpose and talking about the things that they love the most. And I think that's what we're going to do here on this show. But I just have to commend the work you're doing. It is so fun to see you doing it.
Well, thank you. I feel the same for you. And yes, it was so fun seeing you. And I'll probably see you again at the AIC IFM conference coming up.
We'll be meeting up again this summer and just manifesting more connecting points because when I see other practitioners who are in this functional medicine space and really, I think, bringing to life the functional medicine model, how I really think it should be honored, a comprehensive body systems approach. You're focusing on functional psychiatry, but I think everyone will see as they get to know you during this episode, really that incorporates so many different body systems. It's not just your mental health, it's all of these different players that contribute to your mental health. So I'm really excited to talk about how that relates to fertility specifically. And I want to start with this kind of loaded topic of stress. Because people send me messages all the time and they're like, listen, stress is unavoidable in my life, but I'm so worried about how stress is impacting my fertility. Will you just give us kind of a brief or a primer or an intro to how we should be thinking about the role of stress in our reproductive health?
Yeah, I mean, that is such a loaded, important topic right now. I would say, honestly, when I have patients or clients who are struggling with fertility, the majority of the time it's related to stress. So just to say, stress and fertility really go hand in hand to begin with. Our body really has to feel safe before it's going to allow us to carry a child. So if we have chronic stress and we're in this fight or flight state where our body is really in almost survival mode, it is not going to be able to, maintain hormones as it should to maintain a baby. And it's going to basically our brain is going to tell our reproductive system, it's not safe to have a baby right now. You are in survival mode. We cannot grow a baby. You're not going to be able to get pregnant. So making sure that you really work on stress when you are trying to conceive is really important. And also stress directly impacts hormonal health in a few different ways. So one thing that I kind of want to mention that's a big topic in functional medicine in particular is something called the cortisol steal. Normally going back to our stress response, I'll explain the cortisol steal through all of this, but a normal stress response is, something stresses us out, our body produces cortisol or a stress hormone. And then when that stressor leaves or, that stressor goes away, our body goes back into a normal rest and digest state. Our cortisol decreases, we kind of go back to normal. Well, more common in today's society is that we're under chronic stress. So we have chronic stressful situations coming up and our body is chronically producing cortisol, that stress hormone. When it's producing cortisol for a prolonged period of time, it actually starts producing more cortisol and less other hormones that we need for fertility, like progesterone. So we start producing more cortisol, less progesterone, and then our body can't actually get pregnant. We might start seeing, missed periods, symptoms of estrogen dominance, maybe even more PMS symptoms, things like that. And a lot of times that's really based in just this chronic stress response that our body's experiencing.
Oh, the chronic stress is so hard. And people will ask me sometimes, like, do I need to quit my job? Like, do I need to move? How am I going to avoid these? And my hot take, which I'm interested to hear your thoughts, is it's not necessarily that we have to remove these stressors. Like, our job is going to be stressful sometimes, or our schedule and picking up kids or getting to work on time. Like, that's not going away. It's how we can deal with some of these stressors. Like, do we have good skills? Do we have some coping mechanisms? Maybe sometimes we do need to find a new job. I mean, I think that there's time and place for that. But the fact of the matter is the stressors are unavoidable. And so we have to train our brain or get some skills to deal with them. Is that how you approach things too?
Definitely. I would say, there's a lot of things we can do before quitting our job, unless it's really a job that you probably should quit.
I mean, we can talk about it.
Yeah, that's another conversation. But a lot of times people can't change the actual job, or they can't change what's really going on situationally in their family. Maybe they have a sick relative or they're caring for somebody else. But there are a lot of things that we can control in our own life. And I think there's a lot of different things that we can do, and that can be overwhelming for people of like, where do I start? You tell me there's all these things I can do for my stress, but like, what is it? What do I do? Where do I find the help? So one thing I really always recommend for all of my clients is to be working with a therapist, especially if they are experiencing stress. And even if they're not, honestly, I think that having a relationship with a therapist, and doesn't mean you have to see them weekly, but just having that relationship set up can be really, really helpful. So a therapist can do a lot of different things, but they can also, like in particular, they can really help with stress, and that they can give you lots of coping skills for your particular situation. So working with you, getting to know you and what your triggers are, what really triggers stress in your body, and giving you good tools that you can use outside of sessions to reduce that cortisol response, to reduce your response to stress and improve your resiliency to these situations. And I think when I say that it's important to have a therapist, even when you're not stressed, to build that relationship can be really helpful, so that when you do get stressed or something, situationally comes up in your lifestyle or in your life that's really hard to deal with or causes a lot of stress, you can easily reach out to that therapist. You already have them on board. You don't have to start from scratch. And that can be really, really helpful for people. So that's one really big thing. Another big thing that I really recommend is, looking at your own diet and lifestyle. So, what does self-care look like? Are you meditating? Are you going on walks, getting outside, getting some sunlight during the day? What time do you go to sleep, and what does sleep look like for you? Because sleep and stress also directly go hand in hand. If you are not getting enough sleep, your cortisol is going to rise. If your cortisol is rising, you're also not getting enough good sleep. So kind of plays off of itself in that way. And really looking at diet, blood sugar is one of the biggest things I find that increases anxiety. So when you have a major blood sugar response, it's kind of like a roller coaster, right? If your blood sugar spikes, at some point it's going to have to come crashing down. When your blood sugar spikes, typically your cortisol is also spiking. And then you also, when that blood sugar crashes, you're going to feel a lot of fatigue. You might feel more anxiety, shakiness, things like that. So really making sure that you have a well-rounded anti-inflammatory diet that's not full of a lot of processed sugar, that you have enough protein, enough fat to prevent those blood sugar spikes, can be really helpful.
Wow, loving these pro tips. Get yourself a collaborative care team. Do your self-care. There's a lot of things in here that I need to listen to personally. But I think I want to just emphasize this recommendation to have a therapist on board. Maybe you don't know when you'll need them, but oftentimes I find fertility is the stressor. Maybe you never had a major stressor before. And so when you try to get pregnant and it's not working how you thought it would, maybe you haven't developed those skills to cope with a stressor like that because you haven't had something like that before. So having that person on your team who can help walk you through and navigate that process, I think is so helpful. And you had me cracking up about the recommendation, like go outside, get to bed early. I know these things seem so simple, but I really take them for granted. And my studio where I work here is in my basement in my house. And so some days I'll go upstairs and I'm like, oh, I'm so anxious. I feel so overwhelmed. And my husband is like, have you seen daylight today? Like, can you go to a window? Can you step outside for a minute? And, as much as I hate to admit it, you go outside even for 5 minutes, breathe some fresh air, and you really feel better.
Oh yeah, 100%. I used to work in the hospital and you have windows even, but just not stepping outside all day. When I would step outside, I would be like, wow, I am a new human.
Yes.
It really hits you that way. But yeah, I know I really, I underestimate the power of therapists too, but also in addition to that, making sure you have a good, like you said, like a good team on board, right? So, um, fertility is such a stressor. We all know those clients, and maybe some of us have been them, where we're trying to get pregnant. We're trying to get pregnant. We're doing all the things we think are right, and we're not able to. And a lot of times that's because we're so stressed out trying to get pregnant. And then the minute that people kind of give up on that dream or, give their body a break from trying to get pregnant is when I see a lot of people get pregnant, right? But really working with, and sometimes it's hard to see that we're
Oh,
in the stressed
so
out.
hard.
So, making sure you have a good like OB provider on board, a good mental health provider, hopefully a functional medicine provider, therapist, all of those people can kind of help you take a look at what's going on in your own lifestyle or your own life and what your own lifestyle looks like and make those changes so that it'll be easier for you to get pregnant.
Yep. So we talked about the stress hormone connection. And before we move on, actually, do you find that once someone kind of gets a handle on these maybe cortisol imbalances, right? Because we want cortisol to be high in the morning and then decrease during the day. So I don't want to make it seem like cortisol is the villain. Poor cortisol gets like villainized so often, which we do need a little cortisol. But once you see someone bring their cortisol into a more balanced or a pattern that we would expect, do you find that their hormonal health in terms of estrogen, progesterone, testosterone, that those things tend to improve alongside improvements in cortisol?
100%. I find that our adrenals, so our stress glands in our body, or the glands in our body that produce cortisol, the health of our adrenals directly impacts our hormonal health, our thyroid health, really the health of our body. So when we start to re-regulate our adrenals, improve that health of our adrenals, we oftentimes see a lot of improvements in our hormones. And if we still are seeing imbalances in hormones, there are a lot of other things we can look at too. So, making sure that you are getting enough healthy fats in your diet, right? Like we have to have cholesterol to be able to make hormones. Every hormone is actually made from cholesterol. So, are you eating enough healthy fats? Are there other things going on, diet, lifestyle, physiologically that also might be impacting your hormones if you've regulated that cortisol?
Yep, there's a reason in the functional medicine model we go adrenals, thyroid, sex hormones. Like we kind of treat in that order because of the influence those systems have on each other. So I think that was a point well made. We can't move on from the topic of stress without also talking about the gut because, of
Yes.
course, we're functional medicine practitioners. We're going to talk about the gut. Will you tell us a little bit about how stress might impact our gut health? Because we know gut health is so important for fertility for so many reasons.
Oh, yes. I think it all goes hand in hand, right? Everything always seems to come back to gut health, in my opinion.
Mm-hmm.
When in doubt, start with the gut. So, gut health and stress, it's such a complicated, multifactorial relationship there. But stress, first of all, directly alters our gut microbiome. So our gut microbiome being the, good and bad bacteria that live in our gut in balance, or just the bacteria that are in our gut that, those probiotics, things like that affect. So if we are producing too much cortisol, that will actually change what our microbiome, what those bacteria look like, the percentages of the different kinds that we have. And when those bacteria get thrown off, then we can start to experience different things like gas, bloating, constipation, diarrhea, stomach pain, all sorts of things like that. If you think about it, a lot of us, when we get stressed, we actually have those GI side effects. We might get that stomach pain or get a little bit nauseous, or, some people who get really stressed might throw up or have diarrhea, stuff like that. So that's really, your body directly telling you that stress is impacting your gut health. It also really impacts the ability of our body to digest different foods. So one thing I really recommend for clients is mindful eating. So really sitting there trying to chew your foods minimum of like 15 to 30 times, which some people are like, that's crazy, but if
It
you do
is hard,
it,
but I
it's hard.
like it.
It is hard, yeah. But once you kind of train yourself to do it, you really notice like the difference in how your body feels after you eat. And a big part of that is because it helps our body kind of tune into itself, de-stress, and digest those foods a lot better. If we go into a meal really stressed out, we eat really fast, our body isn't able to actually produce the digestive enzymes like it should. And then we have trouble digesting food, which also makes it hard for us to absorb the nutrients from those foods. So then we might end up with nutrient abnormalities, low vitamin B, low vitamin D, things like that, that really impact fertility and gut health and all of those things. So that malabsorption of nutrients can lead to nutrient deficiencies, which also makes it harder for us to get pregnant. And, it's a whole cycle in and of itself. And then the last thing kind of with gut health that I really want to talk about is that 90 to 95% of our serotonin receptors are in our gut. So serotonin is that neurotransmitter that we kind of call the happy hormone, right? When you take an antidepressant, that is increasing the amount of serotonin that's circulating in your body. So when we think about taking an antidepressant, we often think about, oh, that's just affecting our brain, right? It's just making us feel better mentally, emotionally. But really, 90 to 95% of those receptors that it's targeting are in our gut. So one, antidepressants also affect our gut, but that's just showing that the hormone that a lot of us attribute to increased anxiety or depression when it's low is really connected to our gut in general.
So many connecting points here. It's very compelling to take care of our gut. You reminded me, I've shared this on the pod before, but when I was just in my early stages of practice, you're getting your sea legs. It's kind of a scary time. You want to do everything right. So I was like working in front of or eating in front of my computer all the time, like eating while I was charting or eating while I'm looking up research articles. I was never practicing mindful eating. I was mindless eating at all times. And even though I was eating pretty healthy foods, I had terrible iron deficiency and really low vitamin D, and I don't think I had a molecule of B vitamins left in my body because I just wasn't absorbing anything despite, eating a pretty healthy diet. So I think that is a point very well made. Um, and the other piece about kind of this like gut brain axis, I'm so glad you brought that up because oftentimes when someone is anxious or maybe they feel a little depressed and we want to talk about the gut, it's like, well, how are these things connected? Why would you think about my constipation? I'm telling you I'm anxious, but really it's all connected.
Yeah. Oh, 100%. It is all connected. I think, One thing that, especially in our conventional medical model, is that I find so problematic is that people think of mental health and physical health as totally separate when they're
Yes.
really one and the same, right? Every client is a mental health client. Every client is a physical health client. Like that, it's all related in that sense. One thing that's kind of interesting also going back to gut health and how the gut and the brain are connected, is this idea of this new, well, we've all heard of probiotics, but there's this new research studying what we call psychobiotics, which are really
Mhm.
probiotics, or the living organisms that feed the gut bacteria essentially, or make up the gut bacteria. So those probiotics, there are certain strains of them that directly impact depression, anxiety, and other mental health symptoms. And so we are now calling those psychobiotics because they're affecting our mental health as well. But there are certain strains that are directly impacting what's going on in our brain, right? So we can take a pill that's digested in our gut, that's a probiotic, and it is actually impacting what's happening in our brain. And that can be, it does that in a variety of ways. So it can increase what's called BDNF, which really helps with like cognition, um, memory, things like that. It can, reduce inflammation in our brain, which also reduces depression and anxiety. And it can do so many different things. So really showing that impact of things that are going on in our gut and how they can directly change functions of our brain and our mental health.
It's so cool. It's so cool to think about the gut brain connection and um all the ways that there's like bidirectional communication between bacteria and these different body systems. I was reading the other day about, the gut bladder axis and the gut vaginal axis, and now even looking at our joint spaces and like the gut and our joints. It's just really incredibly fascinating. And so to bring us back to what we're talking about with stress and the gut and fertility, one of the things I'm always talking about on this show is that when we do preconception care, yes, it's about having good fertility and getting pregnant easily and having a healthy pregnancy, but it's also about kind of preventing chronic disease later down the road. With it, I think is really powerful and really, really important. And in talking about gut health, you highlighted so many different nutrients that maybe we're not going to absorb if our gut function is compromised. And I've noticed that so many of the nutrient deficiencies that make anxiety worse are also really important for reproductive health. So it's kind of, we can make a case that as we start to work on these nutrients to support our mood and to reduce anxiety, we're also impacting our fertility, which is so, I think, motivating for so many of us. Will you review what some of those most important nutrients are to support those with anxiety?
Definitely. I think that's just going back to what you just said, it's such a key thing to keep in mind, right? That when we have deficiencies, it's not only impacting fertility, it's not only impacting mental health, but oftentimes it's doing both. Some of the big ones that I see that impact both fertility and anxiety are things like, low vitamin D. And a lot of these nutrient deficiencies actually cause other deficiencies that can impact fertility. For example, low vitamin D can cause issues with thyroid. And if you have issues with thyroid, then it's really hard for your sex hormones to function properly. So things like that, there's different cascades that go along with it. But yeah, that low vitamin D is a big one. I would say the majority of my clients who struggle with either depression or anxiety have low vitamin D. So I really aim for a level when you get it tested of about minimum 50, ideally 60 to 100. Making sure that you're supplementing if needed, getting out in the sun, getting the vitamin D in your diet, mindful eating, all of that. So that's a big one. Also looking at our B vitamins. So, B12, and there's also other B vitamins too that we need to not forget. So, are you able to convert those B vitamins into their usable form properly? If not, you might have more anxiety and you might have trouble with fertility. So you might need to take what's called a methylated B complex or something like that. Magnesium is a huge one. Magnesium is needed for over 300 functions in our body. And the majority of us are deficient. I think what's tough about our agricultural system these days is that there's been so much over farming that a lot of the soil where our crops are grown is actually depleted in these nutrients. So even if we are eating a healthy diet with foods that we think are full of these nutrients, we're not getting as much of them as we think that we are. So, majority of people are actually deficient in magnesium. And, I talked about some of the healthy fat omega-3s earlier, but the last one that I really want to touch on is iron. Iron is really key for mood, anxiety, also energy levels. And I would say it's very common for premenopausal women, so women getting their cycle regularly, to be iron deficient because we do lose iron when we bleed. Also, a lot of people during pregnancy will also lose iron. So making sure that you're not iron deficient, making sure you are getting, if you eat red meat, like good grass-fed red meat in your diet. I think there's been a wave of publicity that's made it look like red meat is bad for us, and that's not necessarily the case. So making sure you're really getting those foods with iron in them, also green leafy vegetables, stuff like that can be really helpful. But when you are deficient in these nutrients, not only are they impacting depression, anxiety, energy, all of those things, cognition, attention, but they also do impact your body's ability to get pregnant, and to be able to carry a child to term. So things that you really want to talk to your provider about getting tested and making sure that you're supplementing as needed can be really helpful.
It's amazing when I start people on a high quality prenatal vitamin, which, just as a quick aside, based on what you were saying about our food supply and the nutrient availability, I like a prenatal vitamin for most people to fill in some of those nutritional gaps. Because even when we're eating a healthy diet, it can be pretty tough to reach, 100% of our need of all these different vitamins and minerals and antioxidants just from our food alone. But at any rate, oftentimes when I start people on a high quality prenatal vitamin, they're like, wow, all of a sudden my mood is a lot better. I'm sleeping a lot better. I have a lot more energy. And we realize it's not just for the fertility benefit, that there's all these other systems that benefit from this nutrient adequacy.
Oh, 100%. And, prenatals, I honestly often recommend them to, women of childbearing age who aren't trying to get pregnant as well.
Right.
Because of that, they're kind of like super multivitamins in my mind. And I think a lot of people are like, oh, you're not supposed to take them unless you're pregnant. And I don't really find that's the case. I don't know about you, but I've seen such benefits from them. So.
Absolutely. 100% co-signed on that. And vitamins have their time and place because we've made a case. There's so many ways that these nutrients can impact our health. And then we're kind of on this path of lifestyle factors. And so I want to continue on and talk a little bit about meditation or mindfulness, because this is something that I recommend often to my patients who are trying to conceive. And for many of us, it's like, okay, we're going to find a quiet time and I can see where there's a benefit in that, but maybe it's not. I mean, we don't talk about it as much. It's not publicized as much, the physiological benefits of some of these mindfulness practices. And I thought you'd be just the person to tell us what some of those benefits are.
Yes, well, I love talking about this because there are so many benefits physiologically to mindfulness. And, mindfulness can look different for different people, right? Like you don't have to be sitting with your legs crossed and eyes closed, but really just taking that time for yourself. And you can look up like different mindfulness activities. There are so many different ones you can choose from. But physiologically, there's a ton of studies showing that mindfulness improves heart rate variability, really improves sleep. In particular, I love something called Yoga Nidra. It's a sleep meditation that basically has been shown to not only improve respiratory rate, heart rate variability, but also is used as a treatment for insomnia. But any mindfulness can really help with that. Mindfulness directly decreases cortisol, so that hormone we talked a lot about earlier, and improves our resilience to different stressors. So it allows our body to not respond both mentally and physiologically to stressors as much as we probably would have without the mindfulness. It leads to positive mindset, that kind of thing. But another really interesting physiological impact of mindfulness is that it decreases the pain response. So pain is really interesting, and pain is something that also causes a release of cortisol. And when we, again, have too much cortisol, then that might impact our fertility. So if you're living in chronic pain, mindfulness can be a great way to kind of desensitize that response in your body so that you can kind of focus back in on, reducing your stress response in general, focusing back on fertility if that's what your journey is, or just living your life without as much chronic pain that's kind of taking over everything. And it also, mindfulness increases things in your brain like the BDNF that we talked about that really decreases or increases cognition, helps with inflammation, and it actually allows for something called neurogenesis, which is like the creation of new neural pathways. So your brain actually starts to communicate differently with itself, and change how you can learn and remember things when you are practicing mindfulness.
It's so powerful. I mean, those benefits are really stunning, and it's fun to think about our brains doing all this cool work when we are sitting in quiet, or we are on a walk, or we are gratitude journaling, or we're in prayer, or whatever it is that our mindfulness practice is. And our brain is like doing all these cool things to protect us.
Yes, I know. And I feel like, and I am definitely guilty of this too, of sometimes we live such busy lives and I sit down to try to practice mindfulness and I'm like, oh, I don't have time to do this, right? Like it almost it's so calming that it feels like it's, you need to be up doing something else. But it's one of the most important things that I think we can add into our day, especially if we are struggling with fertility or if we are, pregnant or whatever it is, just to be able to take even 5 minutes to yourself and practice mindfulness can help reset your entire system, and change the outlook of your entire day.
Beautifully said. I'm going to go do some mindfulness right after this. And I know it shouldn't be like this, but for those of us who feel a sense of urgency to do and work and get things done and be productive, it has been helpful for me to think about my mindfulness practice as an action. Like it is productive for me to take that 5-10 minutes to sit in quiet or to do my journaling or whatever it is. I am working towards a goal as I'm doing that. It's not taking me backwards.
Definitely. Yeah. I like how you said that. Like it's not a step backwards, it's really a step forwards, right?
It really is.
Yeah, definitely.
Well, I opened the door for some listener questions for this episode, and I had a couple themes come up that I thought, I'm going to ask Everest because I think this is going to be along your area of expertise. And this is a question that comes up with some frequency. So the listener question I'd like to ask you is, this person says, I have been using an anti-anxiety medication for the last 3 years, and now they want to get pregnant and they want to discontinue their medication, but they're worried about their anxiety skyrocketing. Do you have any advice in this scenario? How do you counsel your patients when this type of situation comes up and they maybe are feeling uncomfortable with the medication, but it's helping so much?
Yeah, definitely. I mean, this is a question I get a lot too. So I think it's a really important one. I'm glad you asked this. Um, there's a lot of things to consider. First of all, I always recommend working with your OB or mental health provider in your particular situation, right? Everybody is different, especially when it comes to medications. But it really, first of all, I would say depends on the type of medication. So there are some medications that are absolutely contraindicated during pregnancy, like you should not be on them, and your provider can help you figure that out. And maybe even, if you are someone who wants to stay on a medication, switch to something that has a little bit more research behind it for pregnancy. But really, weighing, I would say the first step is really weighing the risks and benefits of being on medication. So as we talked about, anxiety and stress can impact fertility and pregnancy. So you need to weigh the risk and benefit of coming off of that medication. Is the anxiety, is that going to be something that's going to come back to such an extent that it's going to impair your ability to carry a child to term? That's a big question that I always talk to my patients about. And then also asking yourself, what lifestyle factors can I improve or can I work on so that if I do come off of this medication, my body is balanced and I am resilient to the stressors that might come up. Have you looked at your sleep? Have you looked at your diet? We talked about some of those nutrient deficiencies and mindful eating and other mindfulness practices. Are you doing any of that? And if the answer is no, or if the answer is, well, a little bit, but I can improve on some, I really encourage you to, work with a provider, optimize your lifestyle in that way, get a therapist on board, and then try to maybe come off of that medication if that's something you want to do very slowly before you try to conceive. The reason I say before, if that's possible, is that then you give your body time to adjust to being off of the medication and seeing if it's something that you can handle, right? Can you deal with any stressors that come up with lifestyle adjustments and with mindfulness techniques? And then kind of see how you do off that medication before your body is under the stress of also trying to conceive or growing a child, if that makes sense.
Yeah, I think that was a really approachable answer. Like, use the tools that you need. There's always something available, and there's no shame in your mental health game, no matter what interventions you need to take care of yourself. So I think that was a really, really helpful answer. And um, anyone who's out there wondering what the path is next for them, I think it starts with a conversation, right? About what does this look like for me? What are my goals? What things have I implemented since I started this medication? And is my body different? Is my physiology different? I think those were very good points. And as we look ahead to taking care of ourselves, I love on my treatment plans to give apps or resources or something that can help people to implement these things. And my favorites are always changing. So I wanted to know right now, today, if you'll give us a snapshot of what some of your favorite apps and resources are.
Yeah, so there are so many. I feel like I'm always like looking for new ones out there. So if
Too.
anybody else has great ones, please drop them in the comments. I would love to see. But
Yes.
one of my favorite things is a mindfulness based app, actually. There's so many out there, so there's no right or wrong one, but I use one called Insight Timer. Um, and I like it because it's free, first of all, which we love free things, right? But it has a bunch of different types and lengths of different meditations, guided meditations, also music. It has those yoga nidra sleep meditations I discussed. So that's a really great tool because, for example, I try to practice mindfulness when I wake up, and sometimes it's, I don't really have it in me to just sit in silence. Like that's not what my body's feeling that day. So I really like a guided meditation, and I'll just throw one of those on, even if it's for 5 minutes, and kind of sets my day up. Or if I have trouble sleeping, I'll put on the sleep meditation. It has, just meditation music. So if you want to just kind of lie down and chill out to some music, it has that as well. There are other ones that are really great, like the Calm app. I'm sure a lot of people have heard about. This is very similar to that. So any of those mindfulness meditation apps are great. Another resource that I've already mentioned is just getting that good therapist on board, or good, also just good functional medicine, OB, mental health provider, whatever that looks like for you. And using that resource. So making sure that you're following up as needed, checking in, especially if you are struggling with something, getting on top of it before it's too late. Yeah, those are probably the biggest things. The other thing I would say, the other resource would be any resources that kind of help, or apps that help with diet. So if you're struggling and you're wanting to increase protein, maybe looking for something that has different protein sources, that kind of thing. Or if you're wanting to balance blood sugar, maybe talking to your provider about, should you get a continuous glucose monitor and getting an app to monitor your blood sugar? So really weighing in on diet to make sure you are getting those nutrients in, and keeping your body in balance so that it can remain healthy and happy and all of the good things.
So many of my faves too that you just listed. So everybody head to the App Store and get your mindfulness app of choice. And even like Everest said, 5-10 minutes a day can be such a game changer. Everest, will you let our listeners know where they can find you?
Yes. So you can find me. I have a website. My practice is Everest Functional Psychiatry and Wellness. Yeah, Kalea, you can give my website in the comments or whatnot. But I have a practice in Texas. So I see clients throughout Texas, some in California, but might be expanding at some point. So you can also reach out to me via Instagram. My Instagram is Wellness with Everest, and love sharing little tips and tricks there and connecting with anybody who wants to follow along. So please reach out. I love connecting with you all and helping out or learning more about your own journey. I think the more we all communicate, the better in this world.
Absolutely. Couldn't agree more. And I wanted to thank our listeners for trusting us as a source of information on their fertility journey. To our show's producer, Paola Martini, thank you so much. And Everest, thank you so much for being with us today and sharing all your clinical insights. It's just been amazing to chat with you.
Yes, well, this has been such a treat. So I'm so honored to be here with you, and we all love your podcast. So very excited. But yeah, thank you all for listening.
See you next time, everyone. Did you love this episode and want to hear more? Head over to drkaleawattles.com/podcast, where you can find more episodes on all things fertility.